Want to welcome you to this class lecture on Bowenian family therapy. We will be looking at it in a summary, and basically for us is that we have had to go through this class, and therefore this is a summary of the therapy, the theory by Bowen in the family systems. So welcome to this class. I'm your lecturer, the Reverend Dr. James Bogua. As an introduction, we look at why Bowen's look at this theory. And basically, Bowen's looks at the family as a unit. And he started working with families which had schizophrenia patients. After observing how every other member was acting within these families, Bowen was able to get a few details for us so that we could understand the family as a system. During this time, he realized that early childhood experiences interact with the current family functioning to create dysfunctions. And that what we are saying here is that advanced or adverse childhood experiences are very, very important in how families turn out to be later on. If we went through traumas in childhood, this trauma is likely to affect us later on in adulthood. Bowen noted that generational inheritance contributes to family dysfunction. The environment of the families we have grown in will, in one way or the other, contribute to either the functioning of our families later on or the dysfunction of this family later on in our lives. Bowen was interested with the emotional systems in the family, and he noted that all people face anxieties in life, but normal people diffuse these and move on. By normal here, we are talking of those families without dysfunctions. However, dysfunctioning families develop chronic anxiety, and therapy for these families is about helping them to deal with the anxieties. Bowen did a lot of good work in this field, and he was able to identify lack of individuation as one of the major symptoms. By this we mean the lack of boundaries within families. He identified 8 interlocking systems in the family. And for us as a class, these 8 interlocking systems will be key towards understanding this theory and how we can employ it in therapy and how we can help our families to recover. The 8 interlocking systems include the differentiation of self, emotional cutoff, triangles or triangulation, nuclear family emotional systems, family projection process, multi-generational process, sibling order position. And at the outset, I would want us to be reminded about some earlier classes we have held in this in some of the units we have had in the university. And if you remember Alfred Adler's work on birth order position, this is where Bowen gets the sibling order position and help us to understand families. Then Bowen's talk of the last interlocking system as the societal regression or social regression. I will be looking at this one at a time. The differentiation of self. Differentiation of self is the ability to be with the family but still maintains one's identity. That is, a member within the family is able to be well aware of his self or herself, to remain within the family, to maintain their own identity with healthy boundaries without getting enmeshed into the issues of those others. Maintaining an identity means knowing and maintaining one's boundaries. And class, when we talk about boundaries, we are not talking about those walls. We are not talking about the electric fences. We are not talking of the fences we fence ourselves with. We are talking of the space that we allow others to come into our lives, and the space we also get into the lives of those others. Every family member is aware of their role and plays it within a healthy family, and where differentiation of self has taken place. Each family member is not afraid of being themselves. In differentiation of self, each member should avoid being fused with the other individuals in the family. Because what Bowen noted, and we also note, is that fused people fight easily since individuals need space to be themselves. Differentiation of self is about my space versus the space of those others. How do I allow those others into my personal space? And how do I feel when those others violate my space? My identity as me, your identity as you, and especially within the primary dyad of the father and the mother. And we are talking of a family here where we have a father and a mother, and they are in relationship of marriage. Then we look at emotional cutoffs. Bowen notes that some individuals escape from solving issues, and especially within the environment of a family. Whenever there are issues, and probably they look critical and they could divide the family, members shun away from meeting the situations and the challenges head on. Instead of facing these challenges, the family members back off, with the final effect as becoming cut off at the emotional and psychological level. Unfortunately, even as family members get unconsciously cut off or back off, the issue doesn't escape away from their minds. They remain unconsciously involved in the issue at hand. Some family members may learn off from the family or break communication. When these individuals learn off or break communication, the end result is that such individuals may get alienated. They are not with their family, yet are crying inside. You know, a situation in which even when somebody is far off in a particular county and the families are in another county, in a particular state, and the other members of the family are in a particular state, yet one unconsciously is still carrying the issue of the families they left or ran away from. This is what Bowen called emotional cutoff. We note also as a class, ladies and gentlemen, that too much differentiation may lead to emotional cutoff even among couples. You know, when the boundaries are too clear, when the space is too marked, when we are so differentiated that one can head east and the other one can head west, and then we can meet at this particular point. Too much of this differentiation, too much of independence, yet a couple is in marriage, may lead to emotional cutoff. Triangles. A well-functioning couple can solve its problems, and this is about the primary dyad. This couple have the right skills and resources for this, which may include negotiation, love, and awareness of each other's needs. However, we find sometimes that some couples may lack this differentiation. They may lack these skills and resources and are not able to solve their problems or the challenges they are going through. And this is where they invite in a third person unconsciously into their relationship. And I'm saying unconsciously deliberately because it is never aimed or meant to bringing in this third person. The third party, often in our contemporary setup, and I'm speaking this from an African setup, from a Kenyan setup, the third party may include the house help, a mistress somewhere for the man, the drinking buddies, etc., since the primary dyad is unable to provide intimacy. This is a situation whereby you find a father getting close to the lady selling the beer to him in a drinking joint. And in the process of this intimacy, they get so close, and this other person replaces the wife in matters of sharing or matters of all the other confidences that would be shared at home. A single parent also may unconsciously accuse their boy or girlfriend to their children. And what happens within families when tribulation comes in is that the children feel very bitter since they have a major problem choosing whom to support. Do they support dad? Do they support mom? No, they desire stability. And whenever there is triangulation, there is the inability to differentiate. And in effect, the children may end up feeling like they are actually being strangulated. They become fused. And these children may get sick psychologically and could rebel, get depressed, or end up abusing substances. The nuclear family emotional systems. Often, we find that once again in our contemporary society, individuals get married to people who are at their level of differentiation. These type of couples then get fused. For example, a man with a problem with his mother tends to marry a lady with issues with the father or the mother. The couple may look okay from the outside, but are actually fused with each other. Loving each other becomes a challenge as they have not differentiated. We have had this joke in our society that Every other man is looking for their mother to marry. Every other lady is looking for their father to get married to. And there is a truth in this statement, according to Bowen. The couple who may be fused because of the family emotional system may need to be helped to deal with this challenge. Because people who are well differentiated often will likely choose well differentiated individuals for marriage and vice versa. The family projection process. Bowen notes that whatever is wrong in the family is born by the weakest member of the family. This weak member becomes fused with the problem of the family primary dyad. And what we are saying here is that a child in a family that is not doing well, a child in a family with dysfunctions is likely to get sick on behalf of the family. They bear the pain of the members of the primary dyad. And this happens psychologically so that the child is like in their mind, if I'm not okay, daddy and mommy will stop focusing on each other, and the focus now will become my well-being. And in this way, daddy and mommy will be okay because they'll be focusing on me. Therefore, you find that the primary family dyad of daddy and mommy stop focusing on their challenge and come together to help the sick member of the family. Sometimes the primary family dyad defocuses from their issue by fighting over the sick child. If the couple solve their issue, the sick child gets better. And you know, this is all a psychological way of the child intervening in the problem of daddy and mommy, because the child feels very uncomfortable when the primary dyad is not working okay. And this Bowen noted for us, and even in therapy this has been noted oftentimes enough, and this is sometimes referred to as children who carry the pain of their parents in order to try and have the family primary dyad becoming okay. The multi-generational transmission process. Bowen argues that anxieties in the family are inherited from the previous generations. These anxieties get worse with each passing generation. One generation can hibernate the problem so that it is even more explosive in the next generation. Noted small differences in the levels of differentiation in the primary dyad of father-mother and their children may result to notable levels of differentiation among individual family members over the generations. And what we are saying here, ladies and gentlemen, is that in our contemporary African setup, I may not know much about the Western setup, and therefore I'll use the contemporary African setup. We find that in some families, we may have had so-and-so, or the father to the father of so-and-so was a witch. We may have had this person bewitched this, and this is why this family is this way. We may have had so-and-so was cursed by their grandfather, and that's why in their lineage we find XYZ happening. And of course, this is transmitted to the children. You know, you are somewhere attending a wedding, and then you are introduced as, this is John. And this village woman, you know, without forethought says, oh, this is John, whose grandfather bewitched almost a whole village. And you know, in your mind psychologically, the seed is already planted that I am coming from a family of witches. And of course, this psychologically becomes such a burden, and you may find it being passed on to generations, where cousins don't speak to each other, where brothers have issues with each other and they pass their issues to their children. This is all that we are referring to as the multi-generational transmission process. Bowen also borrows the concept of sibling possession from Alfred Adler to help us understand some of the dynamics within the family system. And he argues that the birth order determines how the relationship will be among the primary dyad as according to the partner's order of birth. For example, two firstborns are likely to be in a conflictual marriage. And what we are saying here, honorable members of this class, is that if X is a firstborn and they get married to Y as a firstborn, and they grew up in a family in which each of them were forced to do parentification or found themselves acting as parents to their siblings, and then here they meet and they get married, the major challenge is who now continues to be a parent to the other, who accepts to submit to the other, because both of them have been bosses ordering their siblings all through, and they have gotten used to issuing commands and instructions. So in a marriage, now who submits to the other? Further to this, individuals whose birth order possessions are complementary may be less likely to divorce than if their possessions are vice versa. And what we are saying here, a firstborn marrying maybe a fourthborn may end up well. But a lastborn getting married to a lastborn could be an issue. A firstborn getting married to a firstborn could be an issue. Bowen also talks about the concept of societal regression, and what he's telling us here is that human beings will tend to come together temporarily during times of crisis, and this holds true even in the marriage partnership or in the marriage relationship, that if daddy and mommy have a crisis besetting their marriage, oftentimes they will get closer during those times of crisis. Many couples struggle a lot to avoid too much togetherness once the problem is over. Bowen noted that as people experience greater anxiety during periods of social regression, there could impact within the emotional systems of family units. As the anxieties impact on the family, there could be impacts within the emotional system of the family units. And therefore, during therapy, one thing is for this couple to be helped, not only to get close during crisis, but to learn to come closer even when the problem is over. In conclusion, Bowen identified the 8 emotional systems to handle family dysfunctions. And the main aim of therapy is to increase differentiation. And by differentiation, we mean the awareness of self, includes clear boundaries, especially between the primary dyad and then, of course, the children in this relationship. Even when we may have a shared house, even when every room may not be having keys to the bedroom or to our private rooms, differentiation calls for simple things like knocking first before entering somebody's room. It calls for asking to use somebody else's, things, even when we can access them directly. The right levels of respect, the right levels of respecting those other space and having mind respected, the right boundaries, in height, in width, in strength, boundaries in quotes, because boundaries are also a psychological concept, such that daddy is free to thrive, mommy is free to thrive even within marriage. Even when they work, somebody has the freedom to make decisions of their earnings, even when we share these as a family. Bowen used genograms to produce the themes in the family and to study the emotional systems. And genograms are very, very important for us as a class, and I would invite you to go back, look into genograms as done in another unit to be able to describe our families. Because every other symbol within the genogram describe a happening within the family. A divorce, a separation, a member abusing substances, polygamy, like sometimes in some of the African setups, and all these could contribute to the issue of differentiation or lack thereof. And some of the themes Bowen discovers for us using genogram and uses is alcohol abuse, incest within the family and what this will do for the family. And one major issue that will happen with incest is increased family secrets, and of course the aspect of emotional cutoff. When members know what happened, don't want to discuss it, psychologically run away from the main family system, yet this issue continues to be troublesome to the member. The issue of polygamy, the issue of divorce, the issue of favorites in the family, the issue of rejection, critical life events like deaths, marriages of those other family members, triangulations and fusions. We need to note that for us in Africa, the challenge of fusion may be complex in our African setup because of our shared homesteads, and especially in the rural settings, where you find we don't have fences, where you find we don't even have gates unlike in the urban setting. And I want to leave you with this question. What do you propose to be the solution to the fusing or the fusion that could be found within the rural setup? Thank you and welcome. Let's continue to read more and widely so that we understand more in this unit. God bless you and goodbye.